Thank you, Carol.
You're
Happy,
welcome.
Happy New Year to everyone. Thank you for being here this evening. I hope everyone had a wonderful holiday. It's been a great month off. And now we're back to the work ahead. So let me just pull up this agenda.
Madam Chair.
Yes, sir.
Yeah, while you do that, I just got a text from Miss Reed that she's trying to get on. She's Miss Reed saying that she's unable to get on. She's trying to get on, but she can't. If I could resend her the link.
Okay.
Okay, I'll try to resend it to her, but if someone could send it also, okay?
Okay.
Okay, thank you. Thank you for letting us know.
You're welcome.
All righty. Okay, so thank you for that, Carol. So we going to do roll call. Cal, you want me to wait until you're done, or can we do it
you
without?
go ahead.
Okay, great. So Rhonda Joseph, present. We could just call our names for the record.
Monica McCain Brown, committee member.
It's in no order. You could just call. We're just calling it for the minutes.
George State Board member.
Thank you.
Good evening, Sabin Jacques.
Sharon Marshall, committee member.
Hello, everyone. Simone Colbert.
Anyone else that didn't get a chance to state their name for the minutes?
Neeleen Mickle, committee member.
Thank you.
Daniel Heredia from Councilmember Farrah Lewis's office. How are you all doing?
Hi, good evening. How are you?
Good, thank you.
Anyone else? Sabine, is that you? Did you call your name? I'm sorry.
Yes, I did. Sabin Jacques.
Sabin Jacques. Okay, sorry.
It's okay. Thank you.
Thank you. All righty. So I'm gonna if anyone comes in, we'll just add them to the minutes as we move along. And we're also trying to keep count and track of quorum. Just to bring some updates to the committee. We have, I guess, selected a deputy district manager for Community Board 17. That took place maybe 2 weeks ago. I also want to let the committee know that we did conduct our mental health first aid training in District 17 on, oh my goodness, what was that, December 29th, and we did it at the Rugby Library. We had full house. Everyone enjoyed the training and they received their certificates. And we are gonna look about having another training in the district, but there will be one also held at U of T, which is gonna be downtown Brooklyn, which may not be convenient for some folks to travel, but another one is happening there, which is out of our district, but it is happening. So people do see the need for the training. So that was great. And I'm trying to think if there's been any other committee updates. Not to my recollection. But if I do remember, I will definitely fill everyone in. But I don't recall any major updates at this time. but we do have two great presenters that I'm so looking forward. I think ambulatory services is something that our district is in need of. And Kay and Marcello have agreed to be here this evening, two different organizations, to at least present some information to us. And hopefully it may not be useful to you, but it could be useful to someone else in the community. So Kay Ann Lawrence, you are first on the agenda. Again, I want to thank you for being here. And the floor is now yours. Take it
Okay.
away.
Thank you, Madam Chair. And again, I just want to say good evening to everyone at Community Board 17, Social Services Committee, and to say thank you again for extending the invitation to MHHC Brooklyn to be a part of this evening's conversation. Just to give us a little overview of who we are, MHHC Brooklyn is part of the Morris Heights Health Center organization. Our flagship is in the Bronx. We're a Bronx-based organization. This is our first facility being established in Brooklyn. So we are new to Brooklyn, but not new to healthcare. We've been in the healthcare space for about 40 years, close to 40 years. We are a strong partner to the New York City Public Schools, having a significant chunk of our business is within the school-based health center programs network. So we have 20, we serve 20 Bronx-based public schools, 20 sites, I should say, with 48 serving about 48 schools and roughly about 17,000 kids annually. So that said, we have been in serving underserved communities, basically looking at our vicinity where we are located in Flatbush. It sort of mirrors the Bronx a little bit in terms of the communities, the diversity of the communities and the needs of the communities. So with that in mind, we have with the help of our legislative partners. So we can't be remiss in identifying with Assembly Member Briscoe Hamlet, Council Member Farah Lewis, Rita Joseph. They've all been very supportive of us to ensure that we are now able to serve the community at 1095 Flatbush Avenue. That's between, I say, in the heart of vibrant Flatbush. That's where we are located, and that's between Clarendon and Cortellia Roads. As an FQHC, we serve all irrespective, whether you have insurance, don't have insurance, you can pay, you cannot pay, you have your immigration status is normalized or otherwise. We do not turn anyone away. We ensure that we create easy access to care for our diverse communities. We have rolled out with the three services we have rolled out with. They are family medicine, where we serve from the little ones to the seniors. Then we have a women's health center of excellence, where we provide all the spectrum of services catering to women's needs. Our maternal center of excellence. And then we have our pediatrics department. So those are the three principal services with intentions to scale up as the needs are identified, as our communities start accessing care and we're able to assess the needs. We introduce services based on what is most needed. So we are at our location Monday through Friday from 9 to 5, and then on Saturdays we're there from 8 until 4. So basically, in a nutshell, we always consider ourselves part of the fabric of our communities. Wherever we are placed, we consider ourselves an anchor and a safe haven. We provide care irrespective. So that is the message we want to get out to the communities in Community Board 17, that we are here to provide care. It is a community organization. It's the community's resources, and we're just the stewards of those resources, but it belongs to the community. In terms of making, I heard you talk, Chairperson Joseph, I heard you mention about having your training at the Cortelu or the rugby library. Is it the library? We have met with the library folks as well, and we are partnering with them. Our site is available. Just let us know if it is that we can facilitate or accommodate your group for any meetings that you may have. We're here to partner and to collaborate, right? So in of itself, that's who we are, a little bit about who we are. And we're hopeful with your support that we can get the message out to our community that we are here to serve. We're here to help. We're here to make a positive difference in the health outcomes of our community. Thank you.
Thank you so much. I really appreciate use of space. I appreciate the services that you're providing. My first question, and then I'll definitely open it up for anyone else who has questions, is how would one, I guess, access the services? Like, how do I actually get it?
Okay, so we invite people to walk in. No appointments are really necessary. If you want to walk in, we see walk-ins. If it is you want to outreach to us, give us a call so that we can schedule an appointment for you. It's I can share the number. It's 929-512-3900. And of course, you have my email. So if there's someone in the community who wants to get in touch with us, you can certainly share my email information with them as well. And my cell phone number. My cell phone number is again, Community Resources. So my cell phone number, that too is one of the easiest and most efficient ways to reach me. But at 929-512-3900, our team, they're available and answer to respond to the community and anyone calling in. But they can certainly stop by. We welcome them to stop by. We also welcome if, a member of the community wants to get a tour of our state-of-the-art facility, we encourage them to stop by.
And you said your status is not a factor, and the type of insurance you have is not a factor.
None of the above. We are here to provide care, and in addition to the medical services, we also have some supportive services as part of the team. We have a social worker on staff. We have a care coordinator, so anybody who needs additional help may need to have someone come into the home to provide support or assistance. We have that. If it is somebody is food insecure or home insecure, housing insecure, we can facilitate those things. We have the support of our in-person assistant navigators who can also provide support in terms of getting insurance if the person qualifies for insurance. We can certainly help with that, and some of the benefits programs like SNAP and all of those things, we have team members who can help ensure that our community has access. If in the event that someone does not qualify for insurance, we also have a program that is called our sliding fee discount program, where based on the number of individuals in your household and your household income, you're assessed. And oftentimes the cost of a visit might be $3, the co-payment for a primary care visit. For a specialist visit, it might be $20. Oftentimes, there are no costs attached to it. Again, all that is predicated on your household, the number of individuals in your household and your household income. So it's just like a self-declaration in terms of income. So that is how we assess using the sliding fee program criteria and the the self-declaration in terms of your income status, and we take it from there. But again, even if you don't declare, we do not turn anyone away. We are there to ensure that individuals have ease of access to quality, affordable care. That's it. Question, I see someone's hand.
Thank you. Yes, and if anyone has questions, by all means.
Hi, good evening. I'm Sharon Marshall. I'm the Director of Community Engagement and Partnerships for the Bureau of Brooklyn Neighborhood Health, part of the New York City Department of Health and Mental Hygiene. And I have her also, Ms. Simone Colbert, who's my colleague. So first and foremost, I'm familiar with Morris Heights from the Bronx. I became a doula in 1998, and back then Morris Heights had a birthing center.
Yep.
And I loved it. And I was so sad that unfortunately they could not sustain their birthing center, and of course saw other birthing centers like Elizabeth Seton have to close as well. So I do have just personally, you know, affection for the Morris Heights philosophy and community as well, because of my early beginnings in the birthing community as well, and working with the midwives at that time. So so welcome to Brooklyn. Wanted to know also with your maternity services, your maternal wellness services, whether or not you have like a hospital affiliation. Is it Kings County, downstate, and all of that? And of course, I'm sure Simone is going to share with you the plethora of things that we can support the families with, because our Brooklyn Bureau has a strong perinatal health focus. So hospital affiliation, I guess, first, yeah.
Okay, so our hospital affiliations are two of them you mentioned. Kings County is one of them. We are also affiliating with SUNY Downstate, Brooklyn Hospital, Brookdale, and of course, any hospital that is the preference for the mothers, we acquiesce, right? You're not obligated to go to the hospitals that we have affiliations with. What we do is we ensure that their hospital is available, that we partner with, so that we can, in all part of the continuum of care. So we do that. I'm glad that you mentioned about Morris Heights Health Center's birthing center, because again, it's just who we are, always at the forefront, always creating opportunities that others, for the communities that others may not even think about. And yes, I'm glad to mention that we do have doulas attached to our maternal center of excellence in Brooklyn. So we do have that program. We have 2 birthing doulas attached to us. I saw someone's hand.
Are there any other questions? No.
I actually raised my hand on mistake, but I'm so happy to hear that you all have doulas there. That's excellent.
Yes.
Yeah, so we'll definitely reach out to see what collaborations we can do to continue to support.
And we certainly appreciate that. Again, just letting everyone know that we come to the space in Brooklyn with a medallion of service excellence. So we are new to Brooklyn, but we are not new to healthcare. We are not new to advocating for our communities, ensuring that their voices are heard, and the services that they need, that we implement those to ensure they have ease of access.
Thank you so much, Kay. Thank you again for being here and for being available, and definitely for letting us know about this amazing service that's happening, Clarendon and Cortelyou.
Yes,
In the
1095.
heart.
In the heart of vibrant Flatbush.
Yes, you are. And I would definitely love for you to come back and just keep us updated as to what's happening.
Certainly.
Center.
Certainly.
Thank you again. All righty, so we're going to move on in the agenda, and I'd like to introduce Marcello Arroyo. Am I saying that correctly?
No, but don't worry.
Oh, no, please correct me. I gotta learn.
It's very difficult for the English speaking. It's
Oh.
Arroyave.
Oh, for Java. Okay, I got it. I'm gonna practice because we're gonna be in more communication. So you
Yeah,
can
it's,
take it away. The floor is yours, Marcello.
Say again?
The floor is yours. You can take it away.
Okay. Good night, everybody, and Happy New Year. My name once again is Marcelo Arroyave. I am from Sunnyside Community Service. I am the community outreach specialist in a program that is called Caregiver Support Program. My organization has many departments. We are located in Queens. The headquarters is in Sunnyside, but the Caregiver Support Program has a new office in Long Island City. And you are welcome to visit the new location. We have there the home health aid training and the Caregiver Support Program. And in the headquarters in Sunnyside, we have many, many different programs, especially focusing people in need, especially immigrants and seniors. We have a senior center there. We have English second language. We have immigration legal service. And we have a new department right now that is for, I forgot the name right now, but it's elder abuse. If you know someone who is abused for some reason and that person is a senior, we have a new department that is helping this kind of issues in the community. And my program, the Caregiver Support Program, in my program, we cover Brooklyn, Queens, and Staten Island. What is the main service that we offer to the people? First and most important, we are trying to improve the quality of life of the caregivers. That means people who is caring for someone who has some kind of dementia, Alzheimer, or chronic ill. We are focusing this kind of person, caregiver, especially woman, because always for some reason throughout the time, the woman are the person who is caring for some member of the family. Could be the father, could be the husband, could be the uncle, could be the grandmother, but that is the culture, and we are trying to, give some kind of relief to these women who are, out there caring for some member of the family, loved one, but they never choose to do that. And what kind of service we offer to the caregiver? We offer many different kind of service. The most important thing that we offer is that we offer support, many different kind of support.
Before you start with the list, can everyone please mute if you're not speaking? Because it's becoming difficult for me to hear him. Thank you. Thank you. Marcello, please continue.
Okay, thank you. And we have support groups. Oh, no, before I start with the service, I want to let you know what is the process in order to join this service. First, you need to be a caregiver. Second, you need to care for someone who is a family member, a friend, or a neighbor. That means, for example, you have a neighbor and your neighbor lives in the apartment in front of your door. And you are, for example, helping that person to, for example, cook or to receive the food from Meal on Wheels or to pay the bills. You are a caregiver. You can apply to the program, okay? A friend, your friend is alone, that person has memory issues or has some kind of chronic ill, and you are, for example, calling the pharmacy to get the medicine and that kind of stuff, you qualify like a caregiver, okay? Second, you need to be 60 and old, but in some cases, we can, for example, say, okay, you can join, you are 45, 47, 50, 55, okay? We are flexible about that, but the guidelines is 60 and old for the caregiver. Okay, what kind of service? It's totally free. The program is totally free. The state you know, gather the money from the taxpayer, and when the people join the program, the money who paid the service came from us, from the taxpayer. But it's free for the people, for the person who received the service. And we don't ask for any income. When the person join the program, we don't ask to the person for the income. And second, we don't ask for legal status. We don't ask that. We don't ask to the caregiver for the legal status. That means that if you know someone who needs this kind of service, please spread the word. That's the reason why I'm here. Okay, what kind of service we offer to the people in the community? First, we offer counseling. We have a social worker team that is able to do counseling to the people who is caregivers. Second, we offer wellness activities. If you are a caregiver and you are totally overwhelmed with this kind of role, we offer wellness. For example, we invite the caregiver to dinner. We invite to the caregiver to a tour around Manhattan in a boat. We invite the caregiver to a movie, to a play, to relieve that kind of stress, that kind of, overwhelming situation. But because be caregiver is the hardest job in this planet, and especially be caregiver of a person with Alzheimer or some kind of dementia. Is very, very hard. And that person need, not just support from us, need help and many different kind of service. Okay, we offer education and training programs. That means if you are, for example, curious about, for example, what kind of food is better for the care receiver, or what kind of, for example, communication you need to learn in order to communicate in a better way with the care receiver, we have a education and training specialist. We give you a workshop about that topics. We have around 28, in between 28 and 35 topics. You can choose one topic, and the education and training specialist will give you the workshop. Okay, and it's not just for the caregivers. For example, if this community board is curious about some topic, you can say, hey, we want that person here this day and do this training for us or this workshop for us. Okay. And another thing that we offer to the people is relief. That means that, for example, if you are overwhelmed and you need some kind of relief, we offer you 100 hours of relief. That means that if you want, for example, 5 hours by day in order to sleep more, go outside to do shopping, get a part-time job, you can get that and say, I need 5 hours Monday, Wednesday, and Friday. And we will send a home health aide to your home, and that person will be in your home for 5 hours, and you can go outside and do whatever you want in that 5 hours. Okay? And if you need a home health aide forever, like, every single day, 8 hours, 12 hours by day, we can help you to apply to Medicaid. After the Medicaid, we can help you to apply to MLTC. And after the MLTC, you want to get money for be a caregiver, we can help you to apply to CDPAD, okay? We have a Medicaid specialist. That Medicaid specialist will lead you through the process. And in the end, you will get the Medicaid, the MLTC, if you want the CDPAD program. And finally, we have an adult day program that is related to our program. If you want, for example, send your loved one who has dementia or Alzheimer to the center, we can receive the loved one with this ill in the center between 10 a.m. to 2:30 p.m. The hours you can be in your home, you can go outside, go to the shopping store, go to the medical appointment, that kind of stuff. And the person will be with professionals in the adult day program. And the process to apply is this. You need to call to the Care Connections department. We have the number. When you say, hey, I am a caregiver, I need help, I am overwhelmed, stressful because I am caring for my grandmother 5 years ago, I don't have relief, we will do an intake. That intake will be between 40 and 45 minutes long. After that intake, a social worker will call you, and that social worker will do assessment with you. And after that assessment is done, maybe in 2 weeks or 3 weeks, you will start to get the service that we offer to the community. Thank you. So, do you have questions?
Yes, thank you, Marcello. I don't even know where to begin with my questions. Does anyone have any questions for Marcello while I because I've been writing things down? Because all of this is free, you're saying? Maybe that's my
Yes.
first and always question.
And we cover Brooklyn, Queens, and Staten Island.
Okay.
Yes, Mr. Jorge. Yes,
Yeah.
I am listening.
Yeah, good evening. Yeah, thanks for the presentation. My question is that you mentioned that the care, if I understood correctly, you mentioned that the caregiver has to be 60 years or older.
60.
60, yes. Does the patient or the person who's been taken care of has to be a senior or any age?
No, the care receiver, for example,
Yes.
if the person has some kind of dementia, Alzheimer in the 50s, that's a murder. Because the program is for the caregiver. Sometimes we receive people, caregivers that are 40, 45, depends in what situation they are in. And, like the assessment from the social worker will be the key. Like this person is 48, for example, is caring for the uncle who is 65, and the situation is very complex. They will receive the application, and the person could apply to the program. It's not a problem, but it's, one by one. Like it's not something that if you are under 60, it's not. No, we do a study with the with the caregiver, and if we can provide the service, we will refer you to another organization or another program who could help you with that situation.
Okay, and the 5-hour relief program is also free.
Yes, no, everything is free. Education and training, the wellness, the relief. We have right now 100 hours of respite. 100 hours of respite. The person who needs the respite decide how many hours we get by day. Like I need 3 hours of, for example, it's an example. I am caring for my sister who is older than me and she has dementia. But I need to sleep in the afternoon, I need 3 hours of sleep in the afternoon. I will say I need 3 hours by day from Monday to Friday, and we will send the home health aide to my home, and I will go to my room and sleep for 3 hours, and then I wake up and the home health aide will leave until you complete the 100 hours. If you need more hours after the 100 hours are done, we can look for an extension into the program, or we can send you to another organization who has the same program, and we will adapt another organization. We give you another 100 hours, or we will help you to apply to Medicaid to get, the home health aid permanent in your home.
Thank you, Marcelo.
You are totally welcome. Another question?
Yeah. No other questions? Going once? Well, Marcello, your information is there, and that's directly to you, right? That information that you have behind you?
Yeah, I can send you.
Pineapple. And I always want to wait for his bedtime. I wanted my sandwich. Like the part of the sandwich.
That's a question. Carol, is there any way that we can mute? Because I don't have control, so I can't mute folks. Thank you.
You're welcome.
All righty. So if anyone wants to reach out to Marcello, his information is there. And we also have it, so you can reach out to me or to Carol, and we could definitely forward his information on to you. If
I am
anyone.
writing down my email in the chat box, okay, for everybody.
Oh, thank you. That was very helpful, Marcello. Thank you. And I thank you very much for being here tonight. This is some very interesting information, and I'm looking forward to disseminating.
Thank you.
Thank you. So we're now moving on to the new business portion of the meeting. So I want to use this space anyway to, if there's any announcements. And Carol, I know you sent something that was really, really great, an email to me. I don't know if you want to share that information now.
Which one was that? Is that, no, that's done already.
You are mute. You are mute.
It's Joseph?
Yeah, I'm sorry. I got it. So Sharon,
Okay.
I don't know if you want to, thank you. Sharon, I don't know if you wanted to share any information, the information on the mammogram stuff. I know you sent it to me in email.
Yeah, yeah, thank you so much for circulating. So Delta Sigma Theta Sorority Incorporated partnered with Holy Cross Roman Catholic Church, up there on Church Avenue, to offer free mammograms. And we had the opportunity to provide 25 mammograms yesterday. So it was a success. We look forward to that collaboration. So of course, I am a member, but I was also asked to circulate around. I think this was a great opportunity within the community. And based on that, some of the organizations we reached out to circulate would like to have continued partnership providing mammograms. Yes.
That's wonderful. Thank you. And is there anything else that you maybe want to share with us?
Yes. So Simone, do you have things that you want to share? I know because we have our upcoming partners in health chat tomorrow. So.
Yes, we have so many things going on between the Bedford site and the Brownsville site. But as Sharon mentioned, tomorrow we have our monthly Partners in Health chat. And usually at those chats, we discuss various topics such as mental health and maternal health. And we also share resources that are relevant to those topics. I will pull up the link and put it in the chat for anyone that wants to join. That's going to be happening tomorrow at 10 a.m. And just really quickly, some other things that we're able to share for any organizations that are here and they need health data. That's something that we can also provide. We also have many family wellness services such as car seats, pack and plays, our Wednesday workout session. We had story time today, and we're also able to connect families to things such as diapers and wipes. And if any organizations here are interested in having a breastfeeding space at your site, please don't hesitate to reach out. We're able to provide incentives and materials to help support any breastfeeding employees or families that you may serve. Let's see. We're able to help facilitate mental health first aid trainings And we also have our Narcan trainings coming up as well. We'll be offering that monthly at our Brownsville site over the next few months. And I believe at our Bedford site, we're partnering with organizations to get those going as well. If anyone needs a COVID-19 testing van, we can help with that. Emergency preparedness. Sharon, am I missing anything?
Yeah, it's a whole long list. Yes. And so we really see that the desire for mental health first aid is up there. So we have 2 upcoming trainings, one for adult, one for youth. Unfortunately, they are filled and we have a waiting list, but we know that we have to provide more opportunity, and we are partnering with local library branches as well to bring it out to the community. So for example, we'll be hosting one in East New York. So at one of the branches there. So I'm glad that you were able to host the training at Rugby. So yeah, I think it's a whole gamut of things that we offer. And I'm definitely, Simone will reach out to Kay for Morris Heights about partnering as far as connecting people to those things like pack and plays, portable cribs, car seat, all those things that we offer, at no cost to families.
Thank you, Sharon. Thank you, Simone. Is the representative from Farah Lewis's office still here? If there's any announcements or any information you wanted to share? Okay, does anybody have anything else that they'd like to share, new business?
All I wanted to do, I wanted to just share how heartbroken I am about the death of that 13-year-old in the fire. While they're promoting the mammogram bus, we saw, because it's not far from that location where the fire took place. And so if we feel the need for maybe fire safety trainings in the community or not, this is the time of year, unfortunately. But it really breaks my heart that happened.
Yes, Sharon, I totally agree with you, and my heart goes out to the family for sure. And fire safety training, it seems like, yeah, maybe we need to talk more about how that could be rolled out, and maybe it's something that needs to happen. So definitely we'll add that as a food for thought. So I'm going to move on now to unfinished business. The resource fair. To be honest, I sent out a I guess a survey to our chair and to Ms. Frazier to determine if it's something that we wanted to move forward with, and let's start garnishing some volunteers for the fair. And it wasn't returned to me. So I'm not sure if the chair is still thinking about moving forward and how he would like to move forward. So when he follows back up with me, hopefully before our next meeting here, then I will know how we're moving forward, if maybe another committee is going to take it on, or we're just going to try to come together, one big group, and move forward with this fair, because now we're talking February. So I don't know how that's going to really pan out and look, but I will keep everyone up to date as to what's going to happen. So on the agenda, that's what the subcommittee was, forming a resource fair subcommittee. However, I haven't gotten the go ahead from the chair, and so I don't know how we're moving forward, and we haven't really voted formally in this space with a quorum saying we're going to be the committee and we're going to do the fair. So, like I said, as soon as I have more follow-up information, and how he would like to proceed, then I will definitely share that with this committee. Any questions, comments? Okay. And at the top of our agenda, I glossed over, well, not glossed over, but we don't have quorum, so we won't be approving the minutes from September, October, and November, and December now, without quorum. So that again will be tabled for next month. Any questions on that? So if there are any more comments, if anyone has any further concerns they'd like to share, anything we'd like to put on the floor at this point, it's open, and if not, then we're going to adjourn. So I'm definitely opening it up to any last minute concerns or questions.
Sorry.
All righty. Yes.
sorry.
Yes.
Good
Uh-huh.
evening. I did have
Good
a
evening.
question. I do
Sure.
know that One Brooklyn Health had experienced some issues with, I don't know if it was ransomware. It was in the news. Is anyone aware of the status? Because I know that usually there's a representative that do go to specific meetings in the One Brooklyn Health space. Because this does impact patient care. Again, I'm not going into the details of it, but essentially in the news media, there was some, again, don't quote me on ransomware, but there was some attack on their system and they had to do quite a few things. And so I don't know if anybody do attend any meetings as representative. Do they have any updates as to what's going on? Because this affected their electronic medical record. So it's, it's a bigger issue when it comes to that healthcare space. That's why I was just asking that question.
I don't know if anyone here who attends those meetings, I don't have any information about what happened and the results or the follow-up. We can reach out to OBH if that's what you would like and have them come here to this meeting to speak to it. If that's okay, I will definitely put that out there. Or if someone who does go to those meetings would like to speak on what's happening, then we'll definitely share that.
Thank you so
Okay.
much.
You're welcome. Mr. Tate, did you have your hand up? Did I see that?
Yes.
Okay.
Yes. Yeah. Basically, it's for Marcelo. I was wondering because I can't read the website that he has in his background. So I was wondering if you could put the website in the chat.
Oh, sure. And then we can also send it to you via email. I can send you the
If you have the information, you could send everything. It's fine. Thank you.
Okay.
Oh, yeah, I will write down the webpage in the chat.
Chat, and then
You
we'll
need
send it
the
also.
phone number too?
Yeah, the phone number I was able to read, but not the website. But you could put both for everyone. Thank you.
Thank you, Marcello. And then we'll back it up and send all of the info in email so that you have it in multiple places. Does that work?
Yes, thank you very much.
You're welcome. No problem. Is there any other questions? Can I get a motion to adjourn?
Motion to adjourn meeting at 8:28 p.m. Samuel.
Can I get a second?
Julie Mickle, second.
Thank you very much. Everyone have a wonderful rest of your evening. Please stay warm. And I thank you for coming and making yourselves available. And I thank our guests, Kay and Marcello. Enjoy. Thank you, everyone. Thank you, Carol.
You're very welcome.
Thank
Have a
you.
good
Thank you
one,
for
Carol.
inviting me.
Thank you.
Everyone,
Good
Happy
evening.
New Year's to all again.
Oh, yes. Enjoy. Good night.
Good
Bye.
night.
Good
All right.
night.
Good night.
Good night.
getting off.
I got you.